welcome back to Bwoyatingzpodcast. This is episode number 3. I can't believe we're already at episode 3, but I did promise you that this season would have been a great one. The last 2 episodes, we had Nino and Shanzi, then we had Javi, and Javi is a worldwide Billboard producer, and so we also spoke about the state of music with him. We spoke about his work that he has done with Alkaline, and we also talk about a bag of things after that. But this episode, we're going to be talking about vagina. All things vagina. Yes. So we have here Nets, Netania, as many of you might know her, or Nets Chat, right? And we also have Dr. Monique Brown. Now, Monique Brown is known on social media, and she kind of, demystify some of the myths about vaginal health and care. So we're going to be talking about that. Everything vagina, as I've said before. Contraceptives. We're going to talk about period. We're going to be talking about STIs, STDs, the pH balances, all of the things that I'm always a student argue about on social media. At least we're going to be having someone here from the medical profession, right? Medical field. She can tell all of the things them. And it's just for our generation to unlearn and relearn, both men and women, about vagina care and everything pertaining to that, and how we can also improve the overall health of women. Yeah. So once again, thank you so much for joining. Remember, Jive Unique cards. So I say the hat. You don't know the strips already, right? So the hat is basically for any customer, recurrent customer. So once you're a VIP customer like myself, yeah, that can be the one I carry it. Yeah, you get a hat, you get a little package, and you get little things. Then remember, you can also use Bwoyatings. You can get 10% discount on all vehicles, and they now added on to their fleet a minivan. So you want to go country with a friend them and your things them, you don't have to drive your own cars. Have a professional driver, personal driver. You can go enjoy yourself, go and sightsee Jamaica. And also, remember, they have their website at driveuniquecars.com. You can see all the availability, the available dates, available cars, the price ranges. So if you call your friend and I call your uncle or country and I say, yo, nobody who carry in a car. Drive Unique Cars on Instagram and also on Twitter and Facebook, or driveuniquecars.com. Now let's get into the episode. We'll talk about it all. All right, guys. So as I've explained in the intro, I have Netania here, and I also have Dr. Monique Brown, and we're going to be talking about everything vagina. And I'm very, very serious about it. Every single thing vagina, because there's a lot of things that we need to unlearn and relearn as a generation. You understand? So we all know Netania already. Welcome back to the show, ma'am. It's been a minute. Right? You see that all these things. And so Dr. Monique Brown is here. And although she said, man, I have to, read now, bio and all these things, I'm going to still read it because I want you to understand that this is not the double doctor on here. Yeah. So she's a medical doctor in the Jamaica Constabulary Force in Kingston, Jamaica. She studied medicine at the University of the West Indies, Mona campus. She has over 7 years of medical experience in the emergency room, general surgery, and gynecology and family medicine. She has dedicated her social media platforms to teach feminine health education while demystifying common myths and helping to improve the lives of women worldwide, thus gaining over 500,000 support on her social media platforms combined. So Dr. Brown, thank you so much and welcome to my show. I wish that you could have been here, but things happen. All right, so I'm going to be very frank. Right. So I've had this idea to do this show for a minute, for a long time. Right. And I said, clearly, I might not know everything about vagina or things that I think that our generation should want to learn. So I've also gathered some questions from one of my friends, Emma. And Nets also have some questions for herself. I have questions for myself as well, because I've seen a lot of conversations over the internet. And, thank you so much for being here. And I know that you can come correct me until we say, yo, this is foolishness. All right. So I hope you're ready.
Definitely. This sounds like fun. So let's have it and hear what's happening. And Thank you so much for having me on the platform.
No, man, no problem, man, no problem. Okay, so the first question is, how important is vaginal health to a woman's overall health?
Okay, so when we talk about vaginal health, I think persons kind of have the misconception that the vagina is separate from the rest of the body. Mm-hmm. Remember, we need to entertain the body as a holistic fashion. Yes. So we need to talk about mind, spiritual health, mental, physical, emotional health. So when we look at the vaginal health, it's all boils back down to our holistic approach to vaginal health. So people have a misconception as to what vaginal health is. They believe that, if you practice self-care of steaming, douching, these nitpicks of being clean, that is good vaginal health. However, that's just the misconceptions that have been taught for decades, and people have been misled because women have been taught to feel as if they're unclean. We're taught that our periods are unclean. I don't know if you would have remembered, maybe back when you're going to school, you would have heard that women should not go to church when they're on their period, right?
Yeah.
Right. Yeah. They should not cook. They should not touch certain items. All those type of stuff, which modern day medicine has debunked all of those myths. Right. So vaginal health is extremely important, and it's important to understand what true vaginal health means. So it's not the intense cleaning of the vagina, which a lot of persons don't even realize is the actual birth canal, the inside, versus cleaning the labia and the vulva, which is the outside. So the outside is really the vagina. The inside, you have no need to bother with that. That cleans itself. As I said, it's a self-cleaning organ.
Right. And I love that you kind of touch on the vulva and all of that, because you kind of segued into my next question, which is what's the proper way to clean the vagina, right? So the person that sent this question, Emma, she sent a bag of terminologies and the vulva and all that, except I don't really know. So I know that based on my knowledge, you're not supposed to insert soap and all of that inside of your vagina. So what is the correct way? Netania, if you want to answer that first before the doctor actually touch on that, what's the correct way to clean your vagina?
Honestly, guys, and don't shoot me because I know you guys like to tussle in the comment section.
You're right.
But when I was growing up, I really thought that putting soap and stuff in there was
the correct way.
The correct way. Girl, you want someone's evil long time. And honestly, my stepmother saw me one day and she was like, do you know how to wash your coochie properly? And I'm like, yeah, girl, you just put this, soap on the rag and wash it out. And she was like, what are you doing to your vagina? And she told me that it's self-cleaning. And I just go in the shower, use my fingers with some water. She was like, just the water and you should be fine. And I was like, all right, whatever you say. And I've literally been doing that since you tell me up until my big age now. Because that was about 8 years ago.
Right. So Dr. Brown, can you tell us now and explain what is the vulva? What is that exactly? It's the outer part of the vagina, yes.
Right. So it's the outer part of the vagina. The issue is, I would have loved to have...
If you have a look modular or nothing.
Right, I don't. So the module that I have actually is more of a cross section to the vaginal canal. Most persons wouldn't really understand what's going on here.
Right.
However, if we can look at what you can physically see, the outside, which is called the vulva, and it's basically the lips. So you'll see the lips there. They might have different shapes, sizes. Some might be a little longer than the other. They're all variations of normal, right?
Right.
And when you open, you'll see a little hole. That is called vaginal in short. So that's the opening to the vaginal canal. So up there, that's where you have sex. That's where the baby comes through. That is the vagina. That is the actual vagina. A lot of us call the outside the vagina.
The vagina.
That is
call it like vagina.
Right. And that is actually just the vulva that we're seeing on the outside, right? Unless you open and you will see the opening, which is the introitus. And then there's a little tiny hole there, which is basically past urine tube, but not to divert too much. So when it comes to cleaning the vagina, you shower. I know it's typically that you shower head to toe. Yeah, we know this already. However, there's nothing that is special that is needed. Good old water that you just spoke about, that is ideal. Warm water, perfect. So you have the lips here, and you can open them. Just the fingers on the outside, on the inner lips there, rinse, and you're good. So you're not supposed to use the shower head and spray the water up there. But the other misconception is that persons believe that you must use soap to feel clean. The truth is you don't. And we have the misconception also that you need to smell sweet.
Rosy,
I was
right.
going to say that.
Right.
Mm-hmm.
I mean, that's one of my further questions. But what is this thing that, women think, say, your vagina must smell rosy. It must smell like the Garden of Eden, and it must smell like fruit. A vagina is supposed to smell like a vagina. So why is it that they're inserting actual soap? Is it because of what we were all taught in schools, or our parents are not really teaching these young girls how exactly to properly wash their vaginas?
I think it might be a bit of both, because first and foremost, I went to a very prominent high school and we didn't learn any of that, right?
We learned that in my school.
Really? No.
Mm-hmm.
Right, yeah. So I think we just learned the general anatomy and that was it.
Mm-hmm.
And I think we might have had a sex ed class, but it really wasn't much. And if you can remember, most parents are going to object to any teacher trying to teach their children about sex, the female, male body.
Unfortunately.
Right? They're going to, and that's just society. So, for the vast majority of us, our parents would not have taught us anything about our body parts.
Mm-hmm.
The guys tend to, have their father or their mother pull back the first thing and show them, this is how you clean, and pull it back over. So they know to do that.
Right.
Unfortunately, most females would not have their parents come towards them and say, listen, this is the proper technique. Or some of them didn't even know how to do it themselves.
Actual factual. Yes, one. Mm-hmm.
Yeah, because a lot of my mom is probably going to kill me when she hears this. But anyways, back around, how old am I now? Maybe 20 years ago, I can remember seeing my mom with Summer's Eve. And I was like, why? What is this? So, of course, I Googled. And it's not until my latter years I realized that she was using a Summer's Eve douche.
Right.
Why would she be using a Summer's Eve douche, right? Of course, she has followed me on social media also, so she has learned the proper thing. So I haven't spoken about it, but I've not seen any of those feminine washes since. And it's the narrative that is constantly being, produced by a lot of these advertisements, these feminine products, because they literally have products saying rose all day.
Yes.
So you are creating a narrative to tell women that you need to have the odor. Yeah. So they're giving a narrative that you need to have the scent of a rose and lavender, lilac. Like, come on, like
vanilla, all these things.
So that ties into my theory.
Yeah.
I actually think that because, growing up, a lot of times when you're referring to the vagina, I refer to it as like a flower.
Yeah.
So because they keep referring to it as a flower, that's why I know it's such a powerful marketing tool where people can say, smell like a rose, smell like lavender, smell like this. These are all flowers, So it's like a psychological thing where, okay, it's a flower or it's a, fruit, it's peachy, it's something. So that's why it must reflect everything or have all the essence of, a flower or
sense.
a fruit. That's my theory. So it makes sense.
Well, that's actually right. So Dr. Brown, I have a next question and then Netania can ask you one after. So I know that Netania is very open about PCOS, right? So I've seen tweets and of recent years, a lot of discussions, not enough though, but a lot of discussions about PCOS. And I saw something that stated that PCOS is caused by sex, right? Which we know that's wrong. Now, with the exception of STIs and STDs, conditions such as polycystic?
Yeah, yes? Polycystic.
Okay, so it's polycystic ovarian syndrome, which is PCOS, and also inflammatory diseases. Can these things be caused by sex any at all? Because they can't. But what is it and how someone can know? I don't know if Netania wants to share her journey of how she found out, and then you can kind of help us know understanding it more.
Okay, so I saw that tweet when the girl was like, went to the doctor, found out to have PCOS, be safe out there, guys.
Yes.
And I'm just like, this is really grinding my gears because she didn't even, one of two things. she didn't even go out of her way to to Google what it is.
Right.
And two, I know that a lot of doctors won't necessarily explain that to you as well,
Yes.
which is one of my personal experiences. So talking about myself, I found out I had PCOS when I was like 17. I'm a big woman now. Yes, I found out I had PCOS when I was 17. And honestly, the way how my doctor said it to me, I literally thought I was going to die because I did not know what it was. He was just like, oh, it's something with your ovaries. So like his explanation wasn't sufficient. And that's how I know it's easy for a lot of people to have that misconception because I'm going to say, quote unquote, it's still a little new, even though it affects like every 1 in 10 women. It's not new. I'm just putting it in quotes that people talking about it now is more prevalent because a lot of women are finding out that they do have PCOS. And, you know, for me, I was ashamed to talk about it for like years. I think I just started talking about it like 2020 when the pandemic happened. So it's been like not even 2 years yet since I started talking about my journey. And honestly, finding community in like other women saying that, you know, I have PCOS too. And like a lot of the misconceptions I've had about PCOS really just mashed up in it because at one point I was just like, oh, it's only fat women have PCOS. That's what I thought because most, like one of the things is that you gain a lot of weight easily. And I know women now who are like maga, like skinny to the bone. And they would message me like, I have PCOS. And I was like, really? And
is it something painful? Is it painful?
Everybody's experience is different. So what I've learned is that, you know, people have a lot of symptoms. I have very mild symptoms because people look at me and it's like, oh, you have PCOS and you don't have acne. And I'm like, I don't know. I don't have acne. And, you know, I don't have, what's it called? Doc, you can remind me. It's all with the H.
Hirsutism?
Yeah, hirsutism. Hirsutism, yeah. So I don't have that either. And I don't have like facial hair or like hair on my chest. And people are just like, so you really have PCOS? And I'm saying to myself, you can't discredit my, you know, condition and my journey just because it doesn't look like what you have or what you've seen in other people. And I've learned not to do that as well. So, you know, it shows up different in everybody. My own is only really painful during sex. But sex is not supposed to be painful. But it's because I was having sex with people who don't know about sex. So when they literally hitting my ovaries and I'm like, this should not be that painful. So when I actually started having sex with people who know how to have sex, I've not had that issue since, but that was young girl days. When I was like in my early 20s, you know. I'm a big woman now, as I said. But that's really my main thing. I just have like a cyst on my ovary, well, 2 on my ovaries, and everything else is just pretty much mild.
Okay, sounds good. So Doc, don't explain in layman terms as possible, which that's what you're good at, and I love that. What is this PCOS thing? PCOS, what exactly is it? Can you just like maybe list like 5 of the symptoms for the women and also the men who are watching and listening? Okay.
So PCOS is polycystic ovarian syndrome, which is, as I said, a syndrome. It's like a list of symptoms that you would have in a particular condition. And, you know, she just touched on a few of them. Hirsutism, which is this abnormal hair distribution. So you might see the women, it was actually listed as the bearded lady back when they just started talking about PCOS. That's way in the 80s, I believe. So those women would have hair underneath their necks, on the chin, maybe even a mustache. And it's really because of an excess of something called androgen, which is like a male hormone.
Male hormone, yeah.
Men and women do have androgen, but it's just an excess of it, which would have caused it. That's why guys have beards and women typically don't, right? So the hirsutism, which is basically that type of excessive hair growth, they might also have a hairy chest. They might have male type baldness, which is like receding hairline, bald patches, those type of stuff.
Wow.
Then, so as you said, it's really like different degrees. Some persons have it worse than others. I've seen quite a number of clients who, as you would have said, are very thin and they do have PCOS. So it's not like a one size fits all type of thing. Then the next thing that we would see that's common among these women is infertility. So
infertility.
Difficulty getting pregnant, right? So this is not to say that if you have PCOS, you can never get pregnant, because again, there have been quite a number of women that would have had PCOS that would have gotten pregnant. And one of the main factors is depending on what their hormone studies were, which that's like really intense to go into. And it would be best, like, if it is that that person has PCOS, they really speak to their doctor or get a doctor that they can talk to go through all of the blood work, because it's really important to have the blood test done.
Quick question for you, Doc. Quick question, and I don't want to cut you. No, I do know someone, like all these symptoms that you're explaining to me. I know someone that the excessive hair on the chin, beard, whatever the case is, and, other things that might have fall under the symptoms. So for instance, that, women might think that, okay, yes, it is abnormal to have like a beard or whatever the case is, right? But them just normally shave it off. Just say, okay, maybe just hormonal things, yeah? So women know who are watching or listening, if they're seeing these symptoms, because are you going to really go to the doctor and say, hey, I have hair under my chin? You're not going to really do that. So how can you really, like, if you're seeing all these symptoms, like what should you, or how can you advise them that when they go to the doctor and when they ever say to the doctor, like, I'm seeing like what? Yeah, feel pain? Like what exactly?
I mean, you do.
Because the symptoms are different.
Yeah, it is different. You start off by listing your symptoms and what you can also do. And as she said, the best way to tell if you have, because it's actually to do a blood test.
Do a blood test.
So when you list these things to your doctor, which is what I did when I went, they were like, okay, we're going to do a blood test just to check your hormone levels. And then when the blood tests come back, that's when they can say, okay, this is, certain things in the PCOS, or they can say anything else. I know, girl, no doctor, never go science school and stuff. But anything else they can say. So
that it can be painful, Doc. Yes, it can only be painful while it's having sex, or just you can just feel like pain.
So typically, let me finish with the symptoms and then I'll.
Yes. Love that.
Right. So those are two of the main symptoms. Then these persons might have something that we call like a metabolic type of abnormality, which basically comes with the whole obesity, abnormalities with your blood sugar levels, where they are at risk of being diabetic, right? Again, that's how the blood works actually come into place right there. And again, those are some symptoms that they would have. They might have symptoms of diabetes. They're gaining weight really quickly. They're always hungry. They're passing out of their urine, or they just find that whatever they do, they can't lose weight. And then there is the ultrasound that would also kind of gear in towards this diagnosis of PCOS, where they would see multiple cysts. And a cyst is basically a fluid. I could actually show you on this. So this is over here, right? And so basically the cysts are these little balls here, right? Right. So they're just basically fluid sacs, and you would have like multiple cysts in your ovaries when they do the ultrasound. So would it typically be painful? No, unless you do have like a very large cyst that may be ruptured, maybe it's leaking, maybe it's twisted, any of those particular problems. So when you're having your period, about to have a period, or after you had a period, then the cyst can leak or support, and then you could have, abdominal pain. But typically it's not like a telltale sign to say that, I have painful periods, it's PCOS. Painful periods on its own is a different diagnosis, which should be investigated, called, dysmenorrhea, where we look for endometriosis, adenomyosis, like it's a lot of other stuff. And unfortunately, it goes back to what we were taught in society. Like, if a 13-year-old says, oh, mommy, my period is really painfully here, you just don't want to go to school, Right. And I've had 13, 14-year-olds that had very heavy periods, and the parents were misguided because they didn't believe. And the child, black out at school. When they came, the blood count was low because they were bleeding really heavy.
Yes.
Right. So these All right, so these are some things that the parents need to pay more attention to, painful periods, heavy periods. And I guess it's going to be gradual. It's not something overnight. So with regards to what someone would tell their doctor if they think that they're having PCOS, it's really starting to identify the symptoms. One, you should be checking when you have your period. So, for example, you find that your periods are irregular. Again, irregular periods doesn't necessarily mean PCOS, and there have been persons with irregular periods that have PCOS. So, yes, it's medicine. That's a science beyond medicine. It's not just black and white. There are areas of gray that we have to go through all the years of experience, the new information, and kind of, okay, let's rule out this, that, and then we come to the diagnosis. Sometimes that's what happens. So it takes a little bit of time. So if you are having some symptoms that you really don't know what's happening, it's really best to write it down and just go to your doctor and explain. And if you can't explain, you could literally write it down. I have belly pain. Yes. My face has a lot of acne. I never had acne before. Just to make it simpler for you, because we will be able to decipher it, right? So with regards to what persons would see if they would have PCOS, they would typically have that really excessive hair that is not normal. So it's the beard, it's really bad acne, cystic acne, where it's some really large, cyst-looking type of acne scars that they'll have. Two, they might have irregular periods, which means that they really don't know when the period is going to come next. They might be missing periods.
Right.
They might find that they have weight abnormalities, they gain a lot of weight. Or as I said, you can actually be of a normal weight and still have PCOS. They might find that they have symptoms of diabetes, where they're passing urine frequently, they're excessively thirsty, they're always hungry. Or some people just feel unwell. They just feel like something is wrong. They've been trying to have a baby and they're just not getting pregnant. These are all valid symptoms to speak to doctor around.
Right.
So they can.
So my question is, can it be cured, or you can just get medication to see
manage it,
lesser symptoms, or to manage it better? Yes.
Yeah. So once the diagnosis of PCOS has been made, there is no cure. And when I say that, I know a lot of persons might now feel defeated. However, there are multiple factors that can be managed. So it's to try and reduce your symptoms as best as possible. And one of the main problems that women with PCOS have is, one, the hair, because, the hair just does not look feminine. And that's one of the problems a lot of us have. So there are different options. There are hair removal creams, there's laser, there are different pills that would give them. And then it is the fertility, trying to get pregnant. So for that, we have the vitamins, we have offering weight loss strategies. There is the PCOS diet, which helps to kind of improve your sensitivity to insulin, which is basically right. So these are all other options. Then there's the actual fertility medications that they can be prescribed depending on how severe the doctor thinks it is or what phase they've gone through the treatment. So there are a number of options. And as I said, there are a lot of patients who, once they began understanding what PCOS really was, and they started speaking to their doctor a lot more frequently, they would have seen quite a number of improvements. I've had patients who had PCOS for over 10 years, and they have 2 babies, so it's quite possible.
Okay, love that.
One thing I must say though is, and it's what I've realized too, a lot of doctors are really quick to put women on birth control when they realize that they have PCOS, and birth control. Well, it have enough things wrong with it, because I used to take birth control when I just found out. And I was like, take it for 6 months. And I said, okay, those are the worst 6 months of my life. I was so depressed, and everybody who knows me knows like I'm always like a happy person bouncing off the walls. So for me to be like depressed, it was really hard for me. And there's like so many other like side effects from taking birth control. And what I've recently learned last year or 2020, I don't remember, one of them was that a lot of times birth control actually masks your other symptoms. So when women come off birth control, then everything just starts showing up. So even if you never know you had PCOS before, but you're always taking birth control, the minute you decide to stop, it's going to be something completely different. Like your body's just going to change. And I even saw a TikTok where this lady said, 20-year-old me, taking birth control. And then it was like future me was behind a door knocking down to say that this is the wrong decision, because when you stop, your PCOS symptoms are just going to blow up. And I've heard a lot of women talk about it. So I see where doctors are moving from just right off the bat saying take birth control to start finding like other alternatives. And I appreciate the doctors who do that. That's why we still like birth control, my pre, my everything, you know. But I appreciate, the fact that she's like, the PCOS diet and everything, because my doctor did recommend me, if the woman give me birth control, he did send me to like a dietitian. If I don't want to reach yet, I set myself on my own anchor. At that time I was like, okay, I don't care about this. So.
But it's just so funny that you brought that up, because that was going to be my next question, and it was about birth control, contraceptives, whatever the case is. I do know that they can have a lot of effects. Some people, them take birth control like a vitamin, so them take it every day. And based on my little knowledge, and I'm not a woman, I know this already. So why is it that this information is not made known to every single woman out there? Because a lot of women, they're really oblivious that it can have effects. Or is it just the type of birth control? What exactly is it?
Okay, so before I even jump on that, I just wanted to clarify why a lot of physicians are recommending birth control for PCOS. And that's really for the irregularities of the period.
Yes.
So, right. So, the birth control is being used to try and give them regular periods. So a controlled
cycle.
21 days of not bleeding, then you get the 7 days of a withdrawal bleed. And that is one of the gold standards of medicine with regards to treatment of PCOS currently. And I believe that's one of the reasons why a lot of the doctors have opted to start them on birth control. Personally, I don't like birth control at all. I'm not an advocate, but there are scenarios, there are cases where, would have to give someone some type of hormone. And it depends. If someone has irregular periods and they're bleeding quite a lot, would have to try and stop the period in some shape or form. So there is some method to the madness, but as you said, the option should be given. And if the person does not follow through with the option of, the diet, the exercise, all of these other adjunctive therapies, then the whole net is on them. So you were asking about, repeat the question. I think I probably
right. So there are a lot of women that they do take birth control every single day. Like they must wake up, take it, pop it, whatever the case is. But as Netania says, sometimes birth control can kind of mask a lot of your symptoms for different ailments that you might have. So is it healthy to take birth control 365? Is it?
That's a tricky question. Based on the fact that they have been FDA approved, the use of birth control in a control setting is healthy. However, I do believe, as I said, there are other options that should be made while they're available. Unfortunately, too many persons, because they don't want the responsibility of ensuring that they maintain certain types of protection when they're having sexual intercourse, they opt for birth control. So it's not necessarily that they don't know. I believe it's a case where they don't want to know. And hopefully nobody takes this the wrong way, but the vast majority of persons should always speak to their doctor before starting birth control. There are persons who have really bad acne that we will give birth control to.
Yes.
Because, right. So, if you, 7 years ago, I had like the worst acne of my life. My face was like horrible. I went to my dermatologist and she come to me up with antibiotics, which I faced also. And we did it for around 3 months. And then she said, listen, I think maybe I need to put you on diet 35. And I said, no, I'm not taking any type of birth control. I'm not taking any type of hormone. And we would have gone through and discussed it. No. If you don't believe that that option is there with your current physician, go to a different doctor, because you should always be able to discuss your management with the physician. You must always be given the different options, right? You must be given the risk factors, the benefits, and use those information to make an informed decision at the end of the day.
Right.
So a lot of women, they just go to the doctor. I don't want to get pregnant, and I don't want to take the pill. So a lot of them take the injection.
Okay.
And they don't want to hear anymore about that. And that's kind of one of the issues.
No, another main thing, is this pH balance thing, right? No, me never got vagina school, me never got doctor school, science school, chemistry, any type of school. But barely even got school. And me know say your pH balance can be thrown off by literally anything. It can be thrown off by your diet. It can be thrown off by the material in your underwear. Right? Now I'm talking to my friend whom is in her 30s. She have children, every single thing. And she tell me, say, it can only be thrown off by sex. And I'm saying to her that it can be thrown off by sex, yes. But that's not the only reason or the only why. Yeah, right? So let us just debunk that as well. And also part B of that question is, how can ejaculation throw off a woman's pH balance? I love this question. I ask Christ, and this be come about, come on, about this.
I'll just say, because I don't know about other podcast, is a Christian. But I'll just say for truth, like, make the breeze blow wrong one day and your pH balance just gone out the door. Like,
then, a lot of women don't know this. Why is it that me as a man, after I tell you about it, and you are a woman that also has children? You don't know them something. I can tell me, say, a penis alone can't throw off your pH balance?
Because remember, and we even had this conversation, me and you personally, on one Twitter space where we're saying that Jamaica is a culture where we do not talk about sex openly enough.
Unfortunately.
For people to understand certain things. So even big people who have 100 pitney, right? They have so much misconceptions about sex and sexual health, where they are convinced that it's correct and them don't want to learn.
And that's why Bwoyatingz is here, to debunk it all. Because we have to unlearn and relearn. Love this. So we are school. Doc, tell us now, pH balance, the throw off business and all of that. Talk to us.
Okay, so first you need to understand what the pH is, right? So
yes.
pH is basically how acidic or basic something is. Whoa, Dr. Monique, what are you talking about? That sounds like magic. Basically, you know about acid, which everybody would have heard about somebody get acid before and it burns, right?
Yes.
Right. So, an acid is on the lower scale. That number is lower. For the vagina, it's 3.8 to 4.5, which means it's a tad bit harsher than most of the other environments in the body. This is because it is there to offer protection against infections, germs, bacteria, anything that can cause these bad odors, the discharge, everything that you're trying to douche and use a yoni curl to get rid of, right?
Anyway, you must talk about that.
So basically, if your pH is balanced, you don't need to be douching. You don't need to be going to the doctor to get an insert every week or month. You don't need to be buying a pill of work acid. You don't need to be taking antibiotics. You don't need all of those drugs, because at the end of the day, your pH is gonna be your friend right there, and that allows one of the good germs. What good germs, bad germs, everywhere in our body. And predominantly in the vagina, right there in that canal, we have a plethora of germs, organisms living together, which have been living in harmony to keep that pH balance. One of the main ones is lactobacilli, which is like your best friend. If you don't have lactobacilli there, you're at an increased risk for all of these other infections, BV, whatever. So when we talk about what can throw off the pH, we need to think about anything that can get rid of lactobacilli, anything that can raise the level of the pH. So how sex comes into place? One, if you have unprotected sex, your partner can give you a sexually transmitted infection. Yes, so an infection can throw off the pH, definitely. Two, if you have unprotected sex, the semen, which is the ejaculate, can raise the pH of the vagina because the semen is actually a little bit higher. So it's of a higher pH. So it's a bit basic, right? Now, for the vast majority of us, we should be able to overcome that within around 2 days. Our pH will just balance itself. Yes. Once there's no infection. Right. So once there's no infection that has been transmitted, or we ourselves don't already have some germ or bacteria there. Then when we look at something like douching, definitely can throw off the pH. So throwing water up there, which is a form of douching also, throwing soap water, vinegar, mixture, whatever else it is that they mix and they try to spray it into the vaginal canal. What that does, it goes and it removes the good and the bad bacteria.
Mm-hmm.
Right. And that strips your vaginal flora, strips the vaginal canal of everything that is there trying to protect it, which results in changes in your pH. So you're more likely to have infections. When you use scented products or use some of these feminine washes, they can also raise your pH. Then when we talk about our menses, so because when we have our menstrual period, it's actually blood. Blood is of a higher pH also, so that can also raise the pH of the vagina. But as I said, for most of us who don't have any infection, we don't have any problems with our pH being balanced beforehand.
Mm-hmm.
Typically, after sexual intercourse, where we haven't, contracted an infection or anything, or after we have had our menstrual period, where we didn't have really bad yeast or BV before, our pH would typically be fine. It would just go back to being the normal 3.5 to 3.8 to 4.5 afterwards, right? So those are some of the stuff. Then there's a concept that hormones can cause pH imbalances. It's not really rocket science with regards to the clear-cut information for that. There is the concept that maybe if you have elevated, some of the elevated hormones, especially anything leading to like insulin resistance, where you are on the verge of being diabetic, definitely you would be at a higher risk of having more yeast infections, because persons who are diabetic, we find that they have yeast infections more frequently. And when we say yeast, we're talking about fungus. So they can have fungus infections on the nails, the skin, the hair, toenails, not just vaginal infections. And then it boils back to the whole aspect of possibly being having some metabolic disorder or the insulin resistance again, where the type of food that you're eating could contribute to it. So if you're diabetic and you're having, a ton of sugar, then your sugar is not going to be controlled, which is going to put you at an increased risk of having infections, yeast infections, to be exact. So
okay,
that's how that.
And I love that you're kind of going towards the yeast infection thing, because, oftentimes women are afraid to discuss yeast infections and UTIs. They not even want to talk about it with their partners. They don't even want to share this. No, if you're in a long-term relationship, I do think that your health in all forms, should be a topic of discussion. Let us know what would you recommend to avoid yeast infections and UTIs, if they can avoid it. How can they?
Okay, so first, there are two different things. So the yeast infection is within the vaginal canal. So it's vaginal candidiasis, which we term yeast infection, and it's the overgrowth of a fungus that we call Candida albicans. As I said, there are fungus all over our body, and it's a normal fungus that typically can be there. However, it overgrows whenever you don't have enough lactobacilli or your pH isn't as acidic as it should be.
Right.
So, for the most part, home remedies don't really work. And everyone's saying, "Oh, pick up a piece of garlic up there." Garlic is so.
You put garlic in the vagina?
No, like
people put garlic in the vagina. Martin, you knew this? I've never heard of this.
And I saw a doctor tweet it one time. Dr. Nick, I saw a doctor even tweet that, "Oh yeah, you can put it." I mean, I said,
so you put the clove inside of your vagina?
Yeah, you pop it in. I was in a group chat with a few women one time, and we were talking about it. And I'm very ashamed to say that I have tried it before.
You've tried putting a garlic in your vagina? You see, and I'm loving that we're having this conversation.
It was one of the worst things I've ever done in my life.
No, man, I'm loving that we're having this conversation. Wow.
I mean, my friend them say, "Yeah, man, we're gonna try it."
Yeah.
It literally burns your vagina, like burn.
Garlic in your vagina. Okay. Wow. Yeah. So that's a no, doctor.
Right. So it's a no. And why I brought this up is because there's a very viral video that's been going around, and I was tagged in it so many times. And I said, I wanted to pitch it, and I realized the person turned off the comments and stuff. I was like, okay, fine. I think the person is supposed to be a nurse or something, and she was telling the woman, strip the garlic and just leave that in for 12 hours or something like that. Oh my God, like, I can just imagine. It's a no. Garlic is going to burn like crazy. I chew a piece of garlic and I can't even smell garlic like that. No. Garlic's supposed to run vampire that not supposed to put in a vagina. What is this? I don't know.
I think it's because a lot of us, I think not a lot of us, remember some of the foods people, never do foods in school. But the antibiotic that garlic has, so people are saying, "Yeah, man, that's an antibiotics. Just use the garlic."
So that is a no. Right. That's a no. No garlic.
No. It does have antimicrobial properties. So eat it, put it in your food, cook with it, consume it bit more frequently. I have no problem with that. And that would be awesome on your part there. But no for putting it into your vaginal canal. So it's a no. Right? So for yeast infections, typically if you have a bad yeast infection, you need to go to the doctor, because in Jamaica, there's no over-the-counter medication. So you're going to need to get an insert. You're going to need to maybe get some tablets. And typically we're going to give you something like fluconazole, and everyone would have heard of penicillin. Yeast infections are so common, and I'm going to just throw the stats at you. 3 out of 4 women would have had at least one episode of a yeast infection in their lives. Like that's very common, right?
Right.
So this is not something to be ashamed of. Yeast is not a sexually transmitted infection. Having a yeast infection does not mean that you're dirty. So I know quite a number of women might have had that in the back of their mind why they don't want to tell their partner. But, it's something that needs to be debunked. Men and women need to understand this.
Right.
Men need to understand that some women have yeast infections, and if she has a yeast infection and the doctor told her she needs to finish taking, this insert for 5 days and then give her a break or 2 weeks from having sex, she needs to understand that she needs to take a break.
Right.
She needs to allow the medications to work. And I think that is one of the reasons why a lot of women don't disclose it, because they don't believe that their male counterparts would understand.
Right. Unfortunately.
That's a big problem. Yeah, because I think well, I've seen quite a lot of these comments that the partner believes that, it's that sexually transmitted infection that they would have contracted or something. So, yeah.
All right. All right, so we're kind of pressed for time, and I know that we can't take one session and discuss this. So I'm going to see how quickly we can get through these questions. I'm going to just take just a quick break just for 2 minutes. Netania has to run. Just 2 minutes. All right. So we had to take a break from that. So we're going to actually have a part 1 and a part 2 because this discussion needs 2 parts. When I lie, Netania and Dr. Brown is really keeping us on our toes and fingertips. And so I write down my notes them and all these things, like me in a school and a class. So we're going to have to just break right here. Remember to like, share, subscribe, leave comments on what you think about, what we're talking about. If you're learning anything, any at all, just leave the comments in the comment section. And the next episode or part 2 will be available on Wednesday right here on YouTube. Thank you so much for watching.